Well, good morning or good evening when you listen or hear this show. This is For Your Health, a presentation of Medica Pharmacy, and today we're on location at Medica Pharmacy because a busy place sometimes I can't spare people to come out of the office. So if we have to take a pause here, that'd be if things get busy. But more than likely, we'll make it through our show today. Allison, today's show we got a special guest in here today. Tell us a little bit about the show, topic, and our guest.
Sure. We're actually going to talk about nutrient depletions today. So many Americans take prescriptions. We're already a little deficient in various nutrients, as we've talked about in the past, because of the poor diet choices that we have here in America. And a lot of prescription medications can make that problem a bigger problem. So this is Kathleen Donahue. She is a fourth year, about ready to graduate student from the University of Kentucky College of Pharmacy, and she thought it would be a good experience for her to kind of put this subject together and talk to everybody. So I'm going to turn it over to Kathleen and let her tell everybody about nutrient depletions and why it's important.
Well, first, Kathleen, do you know how we're going to solve not having Nerlens Noel on the basketball team? That seems to be the big question bouncing around Lexington and Kentucky. Kidding, you probably could care less about basketball, but welcome.
No, she's an basketball
excuse
fan.
me. She does have an insight into that. Okay.
We just know that March just got a lot freer for us Kentucky fans. Sad but true.
So how do we solve that issue?
You know, I don't know that I have the answer to that. And if I did, I don't know that I would be here.
It is possible that maybe if he had had the right balance of nutrients in his body, his ACL might not have torn. This is a thought. Just a thought. Could happen. You never know.
I think the Courier put together an article recently that was talking about growing too quickly and your growth plates and everything like that. And that's true. Basketball players are very tall, and who's to say that an earlier injury couldn't have exacerbated this, but I really don't know.
They mentioned something that may have happened in high school, which wasn't that long ago for him because he's a college freshman. But we do hear of athletes in particular that will have 4 to 6 inches of growth in a year or 2 years at a certain time, and you always wondered if if you can do something to trigger that. But today let's talk seriously about the fact that we're having to struggle to eat properly to get the right nutrients in our bodies, and if we've got something that's kind of fighting against that, even though we might need them and as being a prescription to solve some other issue in our body, that we need to be aware of that, and we need to take I call it combative action, corrective action.
Right. So actually, I did some research, and the average American takes 12 prescriptions, or will get 12 prescriptions over the course of a year. The average Kentuckian, however, gets 19, and this is data from 2011. So I can't imagine that it would have gone down since then with all the new drugs that come on the market. And actually, the reason that this is so important is because all these prescriptions, they can deplete the body of essential nutrients and vitamins. And so And the depletion of those can cause side effects. And instead of actually replenishing what's been lost, we have a tendency to take another medication to help those side effects. So here we are with medications to treat side effects of the first ones, instead of really getting down to what the true problem is, which would have been nutrient deficiency.
So the other night, and I do not know what the TV commercial for a new prescription that I really had never heard of, but again, because of federal requirements, it talks about all the potential side effects that come from it, and I guess some of them, even though they many of them sounded bad, but a lot of them were caused because of the what these prescriptions do, and we have to be aware of that. And I, a layperson, am not aware of that. You guys in the pharmacy world and the doctors should be, and we should be cognizant of that.
Right. So one of the main deficiencies that we'll talk about, and one of the commercials that I think is pretty big right now, is muscle fatigue and muscle cramps caused by statins. So statins basically are a cholesterol-lowering medication, and maybe some more familiar terms would be like Lipitor, Crestor. The generic names of that would be atorvastatin, and of course you have lovastatin, pravastatin, simvastatin. But with those medications specifically, one of the common side effects, and a lot of our patients are on those medications long term, and they'll complain of fatigue overall, achy, painful joints, muscle cramps, and that really could be attributed to a deficiency in something called CoQ10. And what CoQ10 is, it's the main source of energy for your muscles. So when you don't have it, you obviously can see how you would feel fatigued and sore. And basically, there are certain foods that contain this, but when you are deficient in something, really you kind of need to have a supplement that can provide you more than what you would need on a daily basis. Right.
And even though some, we'll call them multivitamins or some type of, it may not have the right type or enough of CoQ10?
Right. I don't think a lot of multivitamins actually have CoQ10 in
They don't.
it.
Coenzyme Q10 you have to buy by itself, and that's one of the supplements that can make dramatic improvements in how you feel. I mean, so many people will talk about how awful they feel on those cholesterol-lowering medications, and you put them on a good Coenzyme Q10 supplement. Usually you start at 100 milligrams a day. Some people need 200 milligrams, and within 3 or 4 days, it's amazing how much better they can feel. So it's really a great supplement.
And it's a natural product. When I say natural, I'm not exactly sure what I mean by that, but
Sure. And we kind of like to use that term carefully, because a lot of people are under the assumption that when things say natural, that it's natural for you to take it and that it's okay. But actually, a lot of the natural products can be harmful. So it's really important that you're consulted on the supplements that you want to take. And a lot of the supplements also interact with prescription medications. So it's really important to let your doctor and your pharmacy know if you're taking anything additional, or over the counter for that matter, to your prescriptions.
The perfect example of this, I think, is that lead and mercury are natural products, but you sure don't want to take them.
very good example. You mentioned over-the-counter products. So a doctor, you may not even think to tell your doctor that, or your pharmacist may not know that because you may check out and not say, hey, this is what I'm taking. Very good to have interaction with our pharmacists and our doctors on everything we're doing in our lifestyle in the way of intake.
Right, of course. And so I guess kind of on that note, one of the very common over-the-counter medications are proton pump inhibitors, or PPIs. And those are things like, let me think.
Prilosec over the counter,
Prilosec
and Prevacid
are the two over the counter. A lot of people take those, and those are for reflux or heartburn. And basically, how those work is they act on the cells that line the stomach, and they basically decrease the stomach acid. So that way, when you are having the reflux, it's not as corrosive and it's not as irritating to the lining of your esophagus. But because of that, it alters the way that your body can digest food, and because of that, we can't really absorb nutrients as well. So, kind of along those lines, you can see how certain things may not be absorbed well. And one of those things is actually iron. And iron needs to have a super acidic environment in order for it to be absorbed. Other things would be, let's see.
B12.
Yeah, B12.
Magnesium.
And we hear about how important magnesium is.
Right. Yeah. And we'll actually talk about magnesium a little bit too. And one of the other really important things that PPIs inhibit are, or not inhibit, I guess is not the right word.
Well, yeah, inhibit your immune system, sort
Right.
of, because they keep you from killing off bacteria.
Right.
Stomach acid is to protect your body from bacteria and viruses. It's one of your first lines of defenses, your nose and your digestive tract. Well, if you take away your stomach acid, you can't kill off bacteria and viruses, so you're more prone to getting sick. So you have to think about that as if you think, oh, it's over the counter, I can go take I can't even talk today, Prilosec or Prevacid anytime I want, and you end up being on it chronically. You know, you're affecting not only your absorption of the important minerals that she just mentioned, but, you know, you are affecting your immune system and your ability to fight off infection. So it's important to realize that they do deplete you of that, but especially on the iron part and the magnesium, there are a lot of studies that show you cannot replenish your iron and magnesium levels if you stay on that proton pump inhibitor, that even if you supplement, you don't absorb it well enough to fight the problems that you're having because of that deficiency. So a lot of times you will have to be taken off that proton pump inhibitor to restore the balance to your body. So.
Is that the good bacteria that we've gotten rid of that we've talked about before?
You will destroy your good bacteria on a proton pump inhibitor because since you don't digest your food properly, you get undigested food in your intestines that causes inflammation, and it actually destroys the good bacteria. So yes, it can contribute to, it won't kill off the bad stuff, but it contributes to the dying off of the good stuff. So it's in a lose-lose situation there.
All right. Tell us about magnesium.
Yeah, so kind of one of the, so we mentioned statins earlier, the cholesterol-lowering medication. That actually also causes magnesium deficiencies, as well as some blood pressure medications like beta blockers. So that would be atenolol or metoprolol. And then there's also I guess diuretics or fluid medications that help lower blood pressure, and that would be things like Lasix or furosemide, hydrochlorothiazide. So a lot of patients that take these will also be magnesium deficient, and magnesium is involved in over 300 different reactions within the body. So people who have deficiencies with magnesium experience a broad array of symptoms. So that can be anywhere from constipation to headaches to restless legs at nighttime.
Worsening of PMS symptoms for all those women and their men that are with them. We like to keep PMS symptoms under control. I think men would agree with us on that one. So, magnesium can help that. So.
The side effects of that affect the men.
Affect a lot of people. A lot of people, yeah.
Magnesium is also really important because it plays a role in maintaining normal nerve function, and it also plays a role in muscle function. So you want to make sure that you have an appropriate level of magnesium in your body. Another thing that magnesium does is it helps support a healthy immune system. And interestingly enough, blood pressure is involved with magnesium in the way that if you have not enough magnesium, then it actually causes higher blood pressure. So, of course, if you're taking all these blood pressure medications, you're continuing to lower the magnesium levels, and it kind of turns into this vicious cycle. So it's super important for patients that are on these medications to be on a magnesium supplement as well.
Is there a test to tell if we are magnesium deficient?
There is pretty much anybody that suffers from chronic headaches. We always, say that you're probably magnesium deficient. And I tell people the biggest way to tell if you're magnesium deficient, because it's very difficult to find people that eat the foods that are high in magnesium, is how often do you have a bowel movement. If you don't have one bowel movement a day, then I would be willing to guarantee you that you are slightly deficient in magnesium. Or if all of a sudden out of the blue you're like, I've never had high blood pressure before, I eat fairly healthy, I've not gained any weight, but my blood pressure's up, could be due to magnesium.
Can we have too much magnesium, or does the magnificent body find a way to get rid of it if we have too much?
Since it's used to treat constipation, it will get rid of it in the form of multiple bowel movements called diarrhea. And so if you get loose bowel movements or multiple bowel movements, then you're taking too much magnesium. So then you'll back it down. And that's how we dose it. Okay. If you're constipated, we increase it. If you're having more than 2 bowel movements a day, then we lower the dose.
Okay. So our body does take care of it, exactly. and it lets you know as it does that.
Yes. So kind of transitioning, one of the other big vitamins that is affected by medication use, and a lot of Americans tend to be kind of deficient in this vitamin as well, it's vitamin B, or the B complex. So that's specifically what we'll talk about here is B12. And B12 is unique because our bodies don't make it. It's made by the healthy bacteria that grows in our gut and in our flora. Allison was talking about this a little bit earlier, and I think she kind of alluded to this. And basically, you can get B12 from food sources like it's very common in liver and clams and oysters. It can be found in Swiss cheese, which actually has a larger amount of it than other cheeses. But I don't know that the normal person probably eats enough of this to be able to get a minimum requirement. Nonetheless, I don't think that they would get enough to actually fulfill a deficiency. And so basically, if you get ill and you have to be put on an antibiotic regimen, that would wipe out, of course, all the bacteria. So you lose this good bacteria that helps you produce the B12. And when you do that, you probably should be put on some sort of probiotic. And what probiotics do, and Allison may have talked about this earlier with you, is that probiotics help promote the healthy and good bacteria in your intestine to help break down food and absorb nutrients. So we suggest that you be on a probiotic not only while you're on the antibiotic, but afterwards as well. The other interesting thing about, I guess, gut bacteria and producing B12 is, where was I going to go with this?
You can't absorb it. Not only can you not make it, but if you're taking a B12 supplement and you don't have good flora, you won't absorb it. So you have to have good flora to replenish B12, regardless of whether you're taking it externally or trying to make it internally.
Right. One of the big medications that is associated with a B12 deficiency is something called metformin. Metformin is a medication that a lot of people who have diabetes, type 2 diabetes, polycystic ovarian syndrome, they may be put on metformin to help with that. And kind of, it's important to replenish the B12 in patients who are diabetic because the nature of being diabetic in and of itself, the high blood sugar will attack kind of the nerves, and so people will get a numbness or a feeling of pain in their lower legs and in their feet, and that could be either from the diabetes or it could also be from the lack of B12. So a lot of times if they are kind of progressing in their disease state and have constantly higher blood sugar levels, we won't be able to really tell the difference to say, oh, this is a B12 deficiency versus this is a worsening. So it's really important to try to get a B12 supplement on board because, like we mentioned earlier, you won't really be able to replenish those stores with just food alone and diet.
How important is it for somebody to sit down and take a full accounting of everything they do, from their diet to their exercise to their over-the-counter and their prescriptions, and come in and schedule an appointment with a consultant of this nature like you guys are?
It is important because we touched on a little bit, everybody thinks natural means it's okay. Mm-hmm. And there's just a recent thing on CNN about the dangers of supplement use. And, you'll hear people come in and ask for some pretty off-the-wall herbs. We had somebody ask about horsetail the other day because they wanted to rebuild cartilage. Well, there haven't really been any studies that show horsetail does much good. You really need to go with glucosamine and fish oil to get rid of inflammation. So, you can find anything on the internet. Like that commercial says, if it's on the internet, it must be true. Not even remotely correct, right? But there's so much information out there and so many people that want to find a supplement to feel better. There really is no pill of youth, really. There's a few things that'll definitely help, but you have to be careful with your supplement use. Not only is it maybe not the right supplement for you, maybe it could be harmful, maybe it's going to interact with your prescription. So it's important to talk to someone that really knows what they're talking about with supplements. And I'm not saying we're the only ones that know about supplements. We do a lot of supplementations and we have been very well trained in it. Not everybody is. So make sure that wherever you're going, if your pharmacist isn't sure or your doctor isn't sure, then please come talk to us. But find somebody that knows about supplements because you don't want to throw money into a supplement that's not the right thing for you.
Next on your list?
Well, the other thing that I was going to mention with vitamin B12 deficiencies and things that we may not normally think about are birth control pills. A lot of women who take birth control pills will also be deficient in B12, and this can. And another important aspect that I forgot to mention is that B12 is an important factor in making serotonin. And serotonin is one of our neurotransmitters that prevents us from kind of being depressed. So people who are deficient in B12 may also kind of find that they're just not very happy and that they're somewhat depressed. And so a lot of actually patients who are put on antidepressants will be tested for low B12 levels. But anyway, so people who take birth control pills on a regular basis, and normally it's for a longer period of time, will be deficient in B12 as well. And there are a couple other B vitamins that you can be deficient in if you're on birth control pills, and that is B2, B6, as well as vitamin C. And vitamin C helps us stay healthy. It helps boost our immune system. I'm sure that everybody's kind of heard that. And also folic acid. And folic acid helps protect us against cancer. And interestingly enough, magnesium and zinc. And actually, low levels of folic acid in both men and women can contribute to birth defects, so like autism and Down syndrome. Yeah.
So we were talking about that this morning. A lot of women that are on birth control pills and then they decide they want to conceive, and so they come off the birth control pills and they will be put on a prenatal vitamin, most of which have 1 milligram of folic acid. But to replenish a store from a birth control pill can take 2 milligrams or more. So if you're coming off a birth control pill because you want to try to conceive, it's important to not only take a good prenatal vitamin, but to take an extra 800 micrograms to a full milligram of folic acid. But your partner needs to be on it too. So that man that you're going to have that baby with needs to be on the vitamin with the extra folic acid as well. So.
Right.
Very, very good. All right. Well, have we covered everything, or do you have more on your list?
No, I think that's pretty much it. I just there's just a couple take-home points really, and that is if you do have a deficiency, that it's important that you note that we recommend that you take more than what's on the recommended daily allowance, or RDA, and that's really what you see on the back of bottles of supplements or in foods, you can see it on nutrition labels as the RDA. So we actually recommend that you take a supplement. So there'll be a little bit more to help replenish those stores, not just maintain a balance. And then also, like I mentioned, a lot of these can be found in food sources. If you have any questions about those, of course, come in and talk to us here at Medica, but you may not be able to incorporate enough of those to even maintain a normal level, nonetheless replenish what you've been missing. But we can talk to you about specific medications that you're on if you're curious and feel like you may have some symptoms related to deficiencies. Please come in and we can talk to you about anything from your supplements to your medications and try to pinpoint what's going on and help balance it.
Very, very interesting, though, the fact you mentioned at the onset of the program was the average number of prescriptions people take, and every one of them has side effects, and then when you add one to another or one to two others, you can either enhance, or maybe not be enhanced might not be the right word, but you can magnify those side effects potentially, if not knowing what they'll do. The combination of things can always be kind of dangerous and tricky.
It really can be, and I found it kind of scary that the average Kentuckian uses 7 more prescriptions than the rest of the country, which is upsetting. And I think for the last 6 years, Nelson County has won the award for the highest rates of antibiotic resistance, which means we use way more antibiotics than we should, and we don't use them correctly. So we've developed an entire strain of bacteria here in Nelson County that's getting harder to kill. So our antibiotics are getting less and less effective. And the University of Kentucky Infectious Diseases uses us as an example when they talk about resistance, and that's not a good thing. That's not a good thing. We like to be talked about in the fact that most beautiful small town in America, or the fact that Medica Pharmacy was just awarded a U.S. Chamber Blue Ribbon Award, the only business in the state of Kentucky. We don't like to talk about the negative health aspects that we deal with living in this state and this county.
And thank you for bringing that up. We did get that press release a week or so ago and have had it on the radio. And that's year 2 for that award?
Second year in a row. Yeah, and I don't know if any Kentucky businesses got it last year, but I know we're the only one. So I always kind of put that little plug out there. We would really appreciate to try to make it to the next step of getting that Community Excellence Award and getting it down to the 7 regional finalists. We have until February 22nd for everybody to go on to the U.S. Chamber's Dream Big site and vote for us to get that Community Excellence Award. So we would really appreciate everybody out there if they would just take it. Really only takes about a minute or two. You just need a valid email address and just vote for us and send that in, and we would greatly appreciate that.
And you can do that on a daily basis, can't you?
You can, and if you don't have access to a computer, as long as you have an email address, we actually have forms to fill out here that we can go on and do that for you. So if you don't think you can do it, let us have your email address, and we'll make that vote for you on your behalf.
Well, thank you very much, Kathleen. It's very nice to meet you. Year 4, does that mean you're about to wrap it up?
Oh, that's right. That's right. Moving on to the next step.
Which would be, like an internship type of program or something?
Right. I'm actually looking at residency programs. Yes. Yeah.
Well, she's been traveling the world here interviewing for residency programs. So she's been the regional traveler so she's been on the road a lot, spending lots of money in gas, I think.
Well, we congratulate you on your success and thank you for your time today and the great job you did on the research. And our record's still intact. Everybody's survived the interview here on WBRT and BRTV.
Nobody's passed out yet or anything. It's been great.
We got to keep that intact. That's our show today. For Your Health, a presentation of Medica Pharmacy, and we hope that you'll stop by and visit with the people at Medica Pharmacy. And, of course, as you heard Allison say, we hope that you'll go online and vote for them in the U.S. Chamber competition that they're in. So that's our show.